we are now back and ready to listen to the next 5 speeches in this segment. So these are all talks by 5 different patient organizations, and they will share their experience of supporting patients to self-manage their health. So I would like to just briefly introduce the speakers first in this session. So first up is Tessa Jelen. She has been running the British Lung Foundation, now Asthma and Lung UK, Westminster support group for 10 years in London, UK. And she is managing about 200 members there. So Tessa is also a member of the ELF COPD patient advisory group. Also up is Luca Roberti. He is a patient with sleep apnea, and he has founded a patient organization called Apnoici Italiani in Italy in 2016. So Luca is very active across Europe and both regionally, nationally, and European-wide working groups. And he's also part of the ELF Sleep Apnea Patient Advisory Group and a new European sleep apnea network called INSAPO. Anna Spinou is a cystic fibrosis patient from Athens in Greece. Since 2018, she's been the president of the Hellenic Cystic Fibrosis Association, overseeing successful campaigns on early access to new therapies and organ donation. Anna is also a board member of Rare Disease Greece and a union of 28 rare disease associations. We have Carlos Pons. He's a managing director of Respiralia Foundation, a non-profit organization supporting children and their families affected by cystic fibrosis in the Balearic Islands in Spain. And finally, we have Armando Ruiz. He is the international manager of the Spanish Federation of Allergy and Airways Diseases Patients Association, also known as FENAER, with a background in veterinary science and innovation management. So Armando is also a board member of EFA and at the National Patients Expert Committee of the Spanish Society of Allergy and Clinical Immunology, SAG. So I'm very pleased then to hand over to the first speaker, and that is Tessa Jelen. So welcome, Tessa.
Thank you. I'm going to ask you for slides. Yes, there we go. All right. First off, Westminster Breathe Easy. It's an asthma and lung support group. We have about 200 members. Next slide, please. This will show at the end of the talk, and that'll give you full details of our contact in the UK. Next slide, please. Steps to self-management. I'm a patient. I'm starting from scratch really on this, and I'm now finding out a lot more. I'm reading stuff from years ago, but one of the basic tips, it's tips and trips, tips is that the communication pathways need to be established. That's the first step, because self-management cannot work in isolation. Next slide, please. Once our members are referred, we need to identify whether their communication pathway is digital, mobile, landline, or just the postal system. The trip-ups on this is some don't speak very good English. Some you think have Wi-Fi, but in actual fact, they go to the library to pick up their things. So during COVID, it was impossible. They might have a mobile number, but they might know nothing about texting or not have that facility. So there's other problems with communication pathways being established with members. Next slide, please. Part of the establishing the pathways is a link with the healthcare professional, and also establishing reliable information sources. Understanding the patient's diagnosis and medication is part of their learning process. They need to form a local pharmacy contact, join up with asthma and other helplines, know about local community support groups, because most have multi-comorbidities. They're not just with respiratory. The trip-ups are difficulty linking with healthcare. Sometimes they're not aware of the full picture of a patient, housing, other problems, maybe disinformation, misinformation comes in, and sometimes even the wrong initial diagnosis and lack of further thing. Next slide, please. There are some reliable pathways out there. Because if you go online, as someone previously has mentioned, there's lots of rubbish out there. So in the UK, we've got Smart Respiratory gathering data, EPAP, European Patient Ambassador Programme, which I'm proud to be part of, an online training course. The NHS app, Patient Knows Best, is it actually puts your results of your medical records online and you can access them. It's really a good idea. And a new thing in the UK is Orca. It reviews the apps and tells you whether they're reliable or not. So there are some pathways there to help, reliable. Moving on from there, hopefully the slide and all the links are there. Next slide, please. Okay, now first off, we realized that members during lockdown had a problem because one wondered if they had COVID. And I said, well, what's your temperature? They didn't know. So the basic tips are to have at home, if possible, a thermometer, an oximeter, a peak flow meter, and a blood pressure monitor. Jelen, I'm not sure how to say your name, with cystic fibrosis has mentioned there's other equipment too, but this is the very baseline. The trip-ups could be the cost of the equipment, how to use the equipment, not recording results, having education there, and how to manage. World Health Organization is now working with therapeutic patient education guidelines, again, revising them. I got involved there, very, very interesting, and training trainers to and clinicians to help the patient to self-manage. Next slide, please. Home equipment is basic, pictures. Next slide, please. Sorry, we're rushed. So, an example, I'm a member of mine, Fran, is quite seriously ill. She won a survey, won an oximeter, and she was saying how useful that was to self-monitor and record on her personal health record, so that the record and the information was really there for her consultant. It's a part of the benefit of teaching patients to record their data. Next slide, please. My experience was for the group that we purchased lots of thermometers, we had oximeters donated, and we explored further supply through a pharmacy prescription. This was difficult. They were prescribing oximeters for patients who were in the midst of COVID in order to, but they had to be returned. I don't know if they were or not. And then to ensure all domiciliary oxygen users have an oximeter and how to use it. The trip-ups were to distribute this equipment. It was postages, an arm and a leg, training on how to use the equipment, instruction to record results. And a grant application was actually refused on grounds that the NHS was supposed to be supplying these items, but there we go, we did try. Next slide, please. Healthcare providers, current training to help patients holistically. It's really useful to understand about a patient's full picture. Consultants to host group meetings for patients with a specific condition. This gives interactive learning and gives the consultant really inside knowledge of the patient. I think this is more in Europe than it is in the UK. The trip-ups is that the healthcare professionals sometimes, I've actually had a healthcare professional say, oh, I don't think they should use oximeters. Very confusing, you know, for a patient, which brings us back to Iliad's, where you can overreact to some results that when you're self-managing. Current little support for training and networking patients, except through a rehab program. Networking patients, GDPR gets in the way. It's really is quite a problem to network and help each other. Let's move on, please. I've got a major issue with this, domiciliary oxygen. I've got to do some surveys on it. We've recently had people really, really seriously ill and dying from hypercapnia because there's little or no communication. There's no support. I've had a district nurse coming to a patient after 6 years on oxygen, never having any support except from the engineer who just looks at the equipment. I've now got a video to show of one of the members who almost died recently from hypercapnia because, so if we can show the video, please.
Hello there. I want to put in an appeal for more information. Information has always been shortcoming. This information, the lack of it can kill you. Let's talk oxygen. Oxygen is a lifesaver. I've been on it 8 years, so it's also a fatal killer and kills more people than it actually saves in the UK every single year. That's from having too much oxygen, which is deadly. Don't get tempted to turn it up a bit every now and then, thinking you're going to make yourself breathe better. You're likely going to send yourself to hospital. Many people with type 2 lung failure do not make it to the hospital. They die before they get there. If they do make it, they can't be saved because they can't go on the respirator. Information, please, from all you people out there. Tell people about this danger from oxygen. Let everybody know they're putting themselves in mortal danger by turning it up, because that's what happened to me. I nearly died through having too much oxygen. Partly because we've got machines we've got to turn up by hand. Why in this day and age can't we have machines that you can turn up something in your hand? Why can't we have things by radio that you could turn a lamp on nowadays by a remote control? Let's have a remote control machine. It might be more pricey, but what is the cost of a life? Anyway, that's my appeal. Let's get information. That saves lives. Thank you.
Thank you, Derek. Okay, thank you very much. If we can get back to the slides now, if it's possible. Maybe not. Okay. Basically, at the end of the day, yes, we were there. All right, next slide, please. Well done. Thank you for supporting me. I couldn't work out how to do this. This was made by Derek Cummings. He hosts an international Breathe Easy meeting, which is very, very popular. We have people from the States and from all over. So that's him. Next slide, please. And thank you so much, everyone, for sharing. Remember, I'm an amateur, I'm a patient. I'm just saying what I've experienced. No training, but passionate about helping others. Thank you.
Thank you so much, Tessa. So that was really interesting to see. We will now move on to Luca, Roberti. Do put your questions for Tessa in the chat box for the question and answer session that will follow the 5 presentations that we have today. So any questions for Tessa, put them in the chat box and then we'll collect them and we will have a session after the 5 people have been speaking. So Luca, are you ready to join us?
Yes, perfect, thank you. Can you hear me? Okay.
Yes.
Okay. Perfect. Okay. As a patient organization, as you know, sleep apnea and sleep disorder are very common, but is under diagnosis and untreated. In Italy, in particular, with the respect of the potential affected population, 4.5 estimated, only 300,000 people of the patient are in diagnosis and in therapy. Also in the COVID period, in particular during the first phase of the lockdown, not be able to do normal associated activity for COVID. We try to understand how to be useful and close to the patient. We have self-developed a screening application called Apnea with the self-administered validated questionnaire. Another project called the Apno-Point is the digital volunteer. In practice, is the info point take place on the expert patient. We work up to 7 days a week. Also, the association have created a scientific committee with the most representative recognized specialists for pediatric and adult on DRS. We involve the committee for any scientific advice for project or when we need the medical scientific information. Apnea is a simple application that allows the interest of the population with self-administered validated questionnaire from pediatric sleep questionnaire to SunResp to Apple to sleep case and insomnia test. We have used the progressive web app because work with the old device, also computer, smartphone, tablet. Also registered on the section for adult or child. In the step 1, after you put the name, surname, and a valid email, you receive the link on the mail, and you start the screening. On step 3, you see you put anamnestic data, sex, age, weight, BMI, other pathology information if you smoke or you have other medical condition. On step 4, we have SunResp questionnaire specific for sleep apnea with six items. In the second, step 5 in the second questionnaire is the Apnea sleep case with 8 items, is specific for excessive daytime sleepiness. We have also the third questionnaire for insomnia is optional. For each question you choose from 5 severity level, from none to very serious. And then of the second or the third questionnaire, you will receive the result on the screen. Also, the answer has been validated. If you are positive on the questionnaire, you'll be received direct a link for choose a specialist with the result displayed. At this point, it's possible you choose a good center near your city. Also, it's possible you refer to the general practitioner of the specialist. Is interested because when the people register to the screening, we receive the authorization to have the data. Today, we have also more of 750 people use the screening in August 2022. But it's interesting because give us some information, also help the people. In the coming months, we have the idea to publish the result in the index journal. We consider the application of practical useful to prevention. In the next year, we have the idea to produce in the English version. Now I have prepared one poll, if it's possible, send is regarding the medical device regulation. In May 2021, the new regulation came into force to increase the security for medical device. But this means 20,000 devices will require a recertification within 2024, posing serious problem for the patient. How knowledgeable are you on the matter? It's possible to send the poll, please.
So I think we have 100% now.
Okay. Is interested the results, because it's a very important question about the safety of the medical device. But maybe we propose to ELF to organize maybe webinar or the webinar for educational. This is very important for us. Okay. The second part of my presentation is about Apno-Point. Apno-Point is a digital volunteers, we call it. It's an awareness project of the pathology for sleep apnea and the major sleep disorder like insomnia, excessive daytime sleepiness, and restless leg syndrome. I'm at the population to refer to waiting room when you wait in the hospital or in clinics or have patient in therapy. The system was developed entirely by our team with our regular collaborator like IT, web, and graphics. The home page shows 10 different blocks, very simple to see, and let's go and we see them specifically. At the center of the totem, because it's a totem, you have 3 QR codes with the content for smartphone or tablet. We have Apno-Point, Apnea, the screening app, and our website for more people who want to consult at the same time. Conceptually, the tests are very short and not to consult quickly. This is the page dedicated to the pathology, the sleep apnea, the snoring, the excessive daytime. The second page is dedicated to diagnosis. For example, sleep apnea, snoring, the same diagnosis procedure. The third page is explain the therapy or possible therapy of the different pathology. This page is dedicated to the problem about sleep apnea, about the driving license renewal, which created many problems to the patient in Italy, but also in Europe because it's the European directive. This other block is regarding is used with 24 touch screen monitor. When it's possible, when you need like this page for membership, appear the dedicated task to put inside the data. The other part is for the frequently asked question. We have 19 answering question. Also, we have another block to the sponsor will support us of the partnership. We have also in Italy for 4,000 is a contribution that the taxpayer can donate from the annual tax return for the no-profit association. Also, we have the video section with the automatic video. And also, the QR code recall our YouTube channel with more video live webinar or tips and tricks like this. Also, we have the last block included 2 surveys about sleep apnea and excessive daytime sleepiness. This is the Google map. Today, we have 10 4-point operative, which will become 15 around 31 months. And we plan to implement a new one every year. My presentation is finished. Thank you.
Thank you so much, Luca. It's really interesting to see what you're doing also with digital devices and how you collect data and support your patients. So very well done indeed. So now we will move on to what I understand is a joint presentation from Anna Spinou and Carlos Pons.
Hello.
Hello.
Hello, great to see you. I will start first the presentation. So I'm going to share my screen. Are we okay? Can you see my screen?
Yes.
Okay, perfect. So, hello to everyone. I am Anna Spinou, a CF patient, 41 years old, and I'm the president of CF, Hellenic CF Association. I'm going to share my experience on CF self-management in Greece after the revolutionary therapy Kaftrio that totally transformed our lives. So, Hellenic CF Association, it's one of the oldest patients association in Greece, established at 1983, and we represent CF community all over Greece in collaboration with our scientific committee. During our 39 years of history, we managed to change CF in Greece. Ilan told us before what is CF, so I will just inform you that Greece has about 10 million inhabitants, and there are 720 CF patients, and more than 500,000 carriers of the disease. Ilan also described very well how a day of a CF patient looks like. So the main pillars of care is physiotherapy, exercise, high calories nutrition, and medicines for lungs, pancreas, etc. And here we can see the CFTR modulators that are innovative therapies that improve the function of the defective protein. The three first, Kalydeco, Kabi, and Synkevi, are older medicines, only for a limited number of our patients and with lower efficacy. But Kaftrio is the fourth medicine, a triple combination of medicines that it's more effective, and it's the game changer of CF. From 2020, in Greece, eligible patients that are about 70% of our CF population have access to Kaftrio. And in the following slides, I will describe you how Kaftrio changed our needs in Greece. So during the pre-Kaftrio period, we focused a lot to physiotherapy. During previous years, our association had organized the project Physiotherapy and Exercise for adults and children, and for children in collaboration with the CF Pediatric Clinic in Hippocratio Hospital and the Department of Physical Education and Sports of Athens, and for adults with first Pulmonology Clinic of Hospital Soteria, Thorax Foundation, and CF unit of Spinou Hospital. So our participants were trained to physiotherapy techniques and followed a personalized exercise program. And this project was very helpful for them. They had improved their lung and their physical condition. Also, from the start of COVID-19 on 2020, our association took the initiative and has donated until now 300 of home spirometers, you know, the device that is connected to smartphones, as Jelen told us before. So we gave those devices to CF adults and children all over Greece in order to monitor, of course, the effects of Kaftrio and to improve their self-management safely from their home, avoiding the hospital cross-infections there. But despite COVID-19, 2020 was a year of milestone significance for CF in Greece. In close collaboration with Greek Ministry of Health and the pharmaceutical company Vertex, our association managed to activate the early access program to Kaftrio in Greece for patients in critical lung condition before EMA's approval. You should see here Trikafta. Trikafta is the name in USA. It's the same Trikafta and Kaftrio. So Greece was one of the limited number of countries worldwide that managed to activate the early access program. And we had been also awarded for this successful action with Prix Gallian Greece 2021 award. So as a result, 30 Greek CF patients in critical lung conditions started Kaftrio. You can see me in the photo. I was one of them, and the effects were astonishing. I felt the impact in my lungs in just 24 hours. Within a few days, I no longer needed oxygen support. And within a few months, my FEV1 was increased from 26 to 42%. While now I don't need to have a lung transplant. And the same astonishing effects were also for the other patients too. Today in Greece, all eligible adult patients and children from 12 years old, they have access to the revolutionary medicine. And after the recent EMA's approval for children 6 to 12 years old, our younger children are gradually having access to Kaftrio. So 2 years of Kaftrio changed everything here in Greece. We have changed the frequency and duration of physiotherapy. Patients can gain weight, life expectancy is getting higher. And now we are able to live a more normal life. We have the opportunity to study, to work, to be married, and why not to have children, like Jelen. But life transformation brings a lot of emotions. Being healthy after years of slowly dying affects the mental health. Patients who take Kaftrio, they feel anxiety, uncertainty about their new life. They need to learn again who they are, how to live. And of course, the 30% of our CF Greek population who are not eligible to Kaftrio, certainly they feel more anxious. So this year, for the first time, the association offered to CF community the opportunity to participate to a pilot mental health project. The project service is a volunteer service for our association of Dr. Stavroula Rakidzi, a psychologist and cognitive behavioral psychotherapist, and we are very, very grateful to her. So we offered group cognitive behavioral psychotherapy for 3 months in 2 groups, one for adult patients and one for caregivers, in person and online. And the project aimed on reducing anxiety, depressive mode, strengthen assertive behavior, and restarting life. There were 11 participants in patients group and 9 in caregivers group, but due mainly to lack of time and stress with treatment, there were 6 drops out in patients and 4 drops out in caregivers, while 1 participant from each group didn't fill the post-therapy questionnaires. So 8 participants in total were included in statistical analysis, 4 from each group. And questionnaires were given to participants for evaluating the variables that you can see in bold before and after therapy. Most of the variables were improved after therapy, and we understand that therapy was very, very effective. In conclusion, the first pilot studies in Greece with CF patients and caregivers show that group cognitive behavioral psychotherapy is an important part of their health and their mental health. As the sample was small, we will evaluate the efficacy in the long term with a larger sample. And here you can see some positive impressions from our participants of both groups, given orally after the end of the group therapy. And this is our CF team that makes our dreams work. I would like to thank them all for their time and their hard work. Thank you for your attention, and I will be available for your questions in the Q&A section.
Fantastic, thank you so much, Anna. And I think there's a lot of comments to your presentation also in the chat box. So very interesting and impressive presentation.
Thank you.
Carlos, it is
very much. Hello.
Yeah, hello.
I'm going to share my screen. Okay. Let's go. Okay, so thank you very much for giving me the opportunity to speak about the new challenges after Kaftrio in cystic fibrosis. Just a moment. The evolution of investigation has reached a point of no return. State-of-the-art drugs in cystic fibrosis have been a good example with Calideco, Orkambi, Sinkevi, and Kaftrio. The first 3 are good medicines, but Kaftrio is so powerful that is changing the life of people with cystic fibrosis. In Spain, it means that 70% of cystic fibrosis population who has one F508 delta mutation can take this drug. This situation make us think about the coming future. First, we need to keep on investigating for the 30% of cystic fibrosis population who don't have such a good drug, and of course, treating them as usual. That means physiotherapy, physical exercise, and mental health therapies. Second, we need to choose if we still work with the same basis or if cystic fibrosis people taking Kaftrio need another way to treat their new cystic fibrosis to complete the good effects of this drug. Is it enough just taking Kaftrio, or we can do anything else to complement its action? On this second challenge, at the Respiralia Foundation, we think it is too soon to change our work basis. Since 2006, we have been working with the autogenic drainage technique, forming people with cystic fibrosis so that they can be able to self-manage their treatment with the most effective physiotherapy technique to drain the mucus from the lungs. It is based on the co-responsibility of the patient, which means that he or she must become an expert patient. This is achieved by doing homework based on the physiotherapist indications and showing what they have learned at the beginning of the next session. The co-responsibility also implies to be temporarily out of the program if they are not committed with the treatment. The formation that the patients receive includes the understanding of the physiology of the airways and their function, the alteration in the case of cystic fibrosis, the posture and the correct synchronization of the diaphragm in inspiration and exhalation, as well as the increase of the abdominal and thoracic perimeter during inspiration and the decrease of them during exhalation. That means that we have many work to do because it is not easy to apply all these concepts. A good formation is required to have good results. Now, a new paradigm is opening as people with cystic fibrosis taking Kaftrio can think that there is no more mucus in their lungs because they stop coughing from the first week of the treatment, and consequently, they can think no more need for physiotherapy. But they also can see it as an opportunity and seek excellence to promote the best quality of life for them. This second thought is very interesting. When autogenic drainage technique is practiced, by opening the glottis and generating a current due to a difference of pressure, the mucus is drained. As drainage is done first at the upper airways, then gradually at the middle airways, and then the peripheral airways, that is bronchi, bronchioles, and alveoli, the excess of mucus makes the patient to cough in the early stages. So the procedure is stopped and started again. This is repeated until being able to reach the peripheral airways, but it is not possible in many times. With Kaftrio, the upper airways are almost free of mucus, but the peripheral airways remain with the mucus accumulated during many years or other alterations, so they can still be the perfect location for bacteria. Given this situation, we can take the advantage and work with the autogenic drainage to reach the peripheral airways more easily and drain the remaining mucus or repair other alterations to improve ventilation and gas exchange in a more softly way. As a summary, we can say that on the one hand, there are 30% of cystic fibrosis population who need our attention and the best of us to have a good quality of life. On the other hand, by draining the mucus before Kaftrio, we were just seeing the tip of the iceberg, but hardly the basis. Now we can get to the basis of the iceberg and have excellent results that will help the action of Kaftrio. Why should we abandon a technique with so much potential? We are aware that people with cystic fibrosis are fed up with so many obligations and that Kaftrio gives them hope for a more normal life. Perhaps the solution lies in the middle ground. That is, not to do so many physiotherapy sessions as often as usual, but not to abandon autogenic drainage either. The truth is that patients, doctors, nurses, physiotherapists, psychologists, and associations must go hand in hand to improve their quality of life. Let's do it. Thank you very much for your attention.
Thank you very much, Carlos. Very inspiring and interesting, the opening perhaps of a new paradigm. So if you have any questions for Carlos or Anna, please remember to put them in the chat box before we forget, and then we'll follow up after the last speaker. And the last speaker is Armando Ruiz, and he is ready now to talk about online respiratory physiotherapy program. So welcome to Patient Walk Day, Armando.
Hello, everybody. I'm very happy to be here. First, thank you and congratulations to ELF team because to organizing this very well activities like always. I'm going to share with you one of our projects that is an online respiratory physiotherapy program. I am Armando Ruiz. I'm managing the international area of FENAER. We are the Spanish Federation of Allergy and Airways Disease Patient Associations. Nowadays, we represent the main 22 patients associations in the country in Spain, and I'm also working in other projects that you can find here. So, first one, I think that we all agree that respiratory physiotherapy is a challenge. In our country, it's difficult that patients can have access to this treatment, but we need to put on the table the importance of this therapy. So as you know, giving access to the rehabilitation and the physiotherapy can change really the life of the patients, and that's the reason that we started to work on this project. From my federation, we have a clear public position. You need to know that our country has a public health service. So that means that people have free access to the treatments and diagnosis and all the healthcare services, but physiotherapy is not accessible for patients. So this is the reason that we were working on our position, and we have a clear 4 points that you can find here. That's that we must include respiratory physiotherapy on the therapeutic treatment protocols, that we need to provision sufficient places for the professionals that they are working on the rehabilitation. We need to focus on some kind of programs and access to the education activities for patients. This we were talking about in another presentations today, and also taking care about post-COVID problems in patients. So based on that, we started the project 5 years ago. We built a YouTube channel with rehabilitation exercises adapted for home use. So based on that, on this time, we are frequently receiving different emails and calls asking about these services, something interesting for us because we want to spread the importance of this therapy. We create 7 videos with exercises in Spanish, and then we moved and we translated the videos to 4 languages more, to English, French, Italian, and Portuguese. Here are the 7 exercises that we have. The 3 first are the most watched on YouTube. If I am able to share one, let me know one moment if I can share my screen with the video. I will just put a few seconds that you can see what we are talking about. Yeah, I could move a bit, sorry. Okay.
Sit comfortably in a chair. Place your feet flat on the floor and separate them at hip width. Relax your arms and place your hands at the height of your belly. You should feel no tension in your shoulders, neck, and arms, in your belt or trousers. Once you have filled your lungs with
Okay.
feeling how you slightly.
So The idea is to support patients at home. I mean, not. I mean, the professional, the physiotherapy have to be run by a professional, but we think that it's important to teach the patients to do themselves the exercises at home. And these are some of our data that I would like to share with you. We have subscribers to the channel, and the total views of the videos are more than 2 million. So we have a lot of views in Spanish, almost 1.5 million, and then Portuguese, French, Italian, and English. It's important to say really that when I started COVID, more than 2 years ago, all the views were growing so fast. That's true that at this moment, people start to search information on YouTube. And then is when we saw that we started to have much more views than before. Important are where are coming people from. As you see, we have many people from Mexico. We have 20% from Brazil. This is the reason that we're having a lot of views on Portuguese. And then from Italy, Peru, and Spain around 10%. By gender, this interesting to take a look because we have more or less 50% of female and male. As you know, normally women are taking more care about health and healthcare, but at our case, men also are entering and looking for our training program. So from ages, as you see, between 25 and 50 years is the most frequent profile of people entering on the channel. We have also more old people from 55 or more than 60. And just to finish with you about the future are two things important for me that I wanted to share with you. One is that we want to expand the program to pediatric respiratory diseases for child physiotherapy, but also the reason that really I'm happy to be here with you is that, in my opinion, showing to you the data, I think it's an opportunity to start to think more global. So we can start a project from Spain with, in my opinion, good outcomes, good results. I saw another colleagues today explaining, showing another very nice project, but I think that technology today can give us the opportunity to really work together to have the biggest impact possible in our patients. Here you have my contact, the email, and also the phone, because I'm based in Barcelona. So please, if you are attending the Congress, the ERS Congress, if you want to talk with me or to meet me for this project, or just take a coffee, or giving to you some advice about the city, I'm so happy to be in touch with you. So that's everything I wanted to share. I have 2 questions that I sent that maybe we can put now. Yeah, thank you. Will be nice if you want to talk about, if you are saying that access to the physiotherapy is not a problem in your country, that's interesting for me, or you can talk in another way if you contact to me, because I'm very, very interested to know the situation in your country, if really the patient can access to the therapy. So I was thinking that most of the people will say that they have problems, but I see is 60%. That's so interesting. Thank you. I think that we have another one. And here is a bit, I prepared these questions related with my reflection at the end. If you think that it's time really to join efforts, that we are all passionate about doing things differently, trying to take the best projects around us and trying to implement with another point of view more globally. Yeah, One person saying not. Two? Okay, it's interesting. We need to ask them now. That's fine. Thank you, guys. As you know, I am in Barcelona. Please contact me for anything that you want to talk with me or to meet.
Thank you so much, Armando. Thank you for this presentation. And I see there are also good comments in the chat box about your presentation. So you might hit the right time with your question, because both our outgoing and incoming EIS president, they're very interested in promoting the International Respiratory Coalition.
Yeah.
And this could be one of the topics, right, that could be discussed there. So thank you so much, and I will see you in Barcelona very soon.
Yeah.
We will
now, very nice.
Yeah, we will now move into the question and answer session, and I'm now rejoined by the speakers and also by Mikaela.
Yes, thank you so much for great presentations. And like we said before, some of you have put the questions in the chat, but I would really encourage you to put on the video and raise your hand, because it's always lovely to hear another voice. And but first come to Tessa. I will say what an amazing job you are doing. And may I ask, what is the most common question asked to the support group?
Asked by us or asked by the members?
By the members.
By the members. We get what to do with an exacerbation is actually quite common.
Thank you. Thank you. Then I'm hand over to Olivia Holton.
Hi, Olivia. How can I help?
Oh, sorry, I was trying to find my unmute button. So you're speaking quite a lot about sort of giving people the digital devices and different tools to use to monitor their condition, and I kind of put it in the chat. Really about what guidance that goes along with that, because particularly around pulse oximeters, it can be a bit like oxygen as well. These can be really dangerous when they're used in the wrong way. For example, like if someone with, and I see it a lot on social media, severe asthmatics posting that they're desaturating, and it's like, well, if you're desaturating as a severe asthmatic, you should have been in hospital a long time ago getting the help. And there seems to be so much ease to get all these devices, but not much guidance and protocols around using them.
I fully agree. You're absolutely right. But this is the problem. I mean, this is what we're mentioning with the oxygen. I have at least 5 members who have been on oxygen for more than 6 years and have not had one review of their oxygen. And the only person they see, absolutely isolated, is the engineer to look after the equipment. So you're absolutely right. I mean, I did say this was one of the trip-ups. This is one of the problems, is the education, learning and recording how to use the devices properly. I fully agree with you. It is, in my book with the oxygen, it's in the central London area. It is a moot problem, which I'm hoping to take forward. Thank you, Olivia.
Thank you. And I don't know if anyone of the other speakers want to also answer this question, because it's about all lung diseases.
Yes, I would like to add something.
Yeah.
I agree with Tessa. We have to be very careful with these devices. We saw it in Greece when we donated the home spirometers. All patients, they are always doing the exam and to see their FEV1, but we have always to be in contact with our doctor. So this is the one that will advise us and tell us the results and tell us what we have to do. We have not to be anxious and afraid all the time. So we have to be careful with the use of devices, of these home devices.
There's nothing to be used in isolation. This is the thing. You cannot self-manage in isolation. You need this
Yeah.
Communication.
Thank you.
The thing may be, or the question may be, what frequency of supervision of a professional we patient needs. So isolation is not good. New technologies can make a difference, but we have to combine seriously what we can do at home and what we don't have to do at home, or at least be realistic that some uses of these new devices cannot be correct. So the results will not be correct, and anxiety can appear if you see some results that are not good. So let's take with very much care all these results and the use of these devices.
Thank you, Carlos. And now I will give the word to Nicole, and you can say to whom you are addressing the question.
Yeah, no, that's exactly what I think. What Carlos mentioned before. You know, we have to pay a lot of attention. We can't replace the doctor, so self-management is very important. But of course, it has its limits, and we have to be aware of this. Also, of the age of the patient. You know, a lot of things at the same time. If the patient is living alone or living accompanied by a husband or by someone of the family, it makes a big difference. So we have to be very careful with this, and we can't replace the doctor, you know. So I agree absolutely with Olivia and with Carlos on these points.
Yeah, thank you so much, Nicole. I got a question here also that I was going to ask. Can all speakers, if they agree with the statement that most important thing with use of home monitoring devices in relationships between healthcare professional and patient, and how this could be cultivated? The question is to the five of you who just spoke.
It's not an easy question.
No.
I think people are thinking a little bit, but I see maybe people are getting ready to propose an answer.
Yeah, but during the time I can ask Armando, because I think it was amazing how many countries you have reached all over the world already. So the question is, how did you do it?
I don't know. I mean, at the end is a need there. Sometimes you need to build complex devices, complex things. Sometimes you need to identify a real need and propose something easy and simple to access and to use it. So it's true that this is our first step. I mean, it's a YouTube channel with a lot of views, a lot of people entering there that have some kind, really the data that I share with you. But our idea is to move on and trying to have something a bit more personalized, something more that the people can take more advantage. The question that you asked before, Mikaela, I mean, for me, it's very important that we are going to use technology more in a personalized way. So I'm always talking about digital therapeutic because it's one of my topics that I'm working from a couple of years ago. But we need to take care, patient organizations need to take care about this kind of solutions because are really patient-centric solutions. So it's not a device that is monitoring some kind of data, are solutions that have a real impact outcome in the healthcare of the patient. So it's like a medicine, and they have to follow some hard regulations from Europe, and they have to make clinical trials. I mean, are these digital solutions that I think are going to change really the care of the patients themselves and the self-management really.
Yeah, thank you, Armando. And Luca, you haven't spoken. Do you want to add something?
No, in particular. Thank you.
So I have a question also. So I think it was very interesting from Anna and Carlos to hear about the huge progress that are made in CF and how we might think of it as a paradigm change. So I just wanted to touch in with you and here, do you think that we're using the right terminology, or does the paradigm change, or possible paradigm change, also involve us changing language, such as changing self-management to co-management, or different kind of terms? How far would you take it, this paradigm shift?
I'm not sure that I understand the question, but okay, I will answer. I believe that we have to cooperate with the doctors, with our clinicians. Of course, we are sure that the CF is so the progression is very, very huge, but we have to visit our doctors, do our treatments. We never abandon physiotherapy, never abandon our medicines, our inhaled antibiotics, pulmozyme, and of course exercise is now that Kaftrio has a huge impact. We have to exercise a lot and more. We can exercise now, because before it was very difficult for us to follow an exercise program. And it's very, very, very positive this. We live in a new era for CF. We are very lucky that we are alive now with a new drug. This is very good for all of us. And I think that next years, we will see more and more revolutions in CF with new medicines after Kaftrio, with gene therapy that will be for all mutations, no limit to mutations. So I think that we live now in a new era, and we are very, very lucky. I'm 41 years old, and I'm very lucky to live my dream. I was dreaming of this when I was born, from the day I was born.
It's fantastic to listen to you. So I just wanted to follow up to you, Anna. Then, do you think that Kaftrio has changed your relationship with your healthcare professional? Is it different now after this?
Yes. After 2 years of medicine, yes, my relation was changed. My visits in this CF unit are rare now. My communication is by telephone or by email, and because of COVID. But when you take Kaftrio, the life is easier. You don't need hospitalizations. Before Kaftrio, I was hospitalized about 6 or 7 times a year. Now, only 1 time after Kaftrio, I have do my IV therapy. So I think the relation is more, all CF patients from the day that we are born, we are always need our doctor every day for everything that, for every problem. So this is deliberating now. We feel more independent, and we need our doctor only for special occasions, not every day. This is relaxing, I think. So yes, our relation has changed to a better relation and deliberating for us.
May I say something?
Yes.
I think doctors now has a most easiest way of communication with the patient, because most of the news he or she has to give are positive, because the change is incredible. So before, many news could be negative, and that was difficult for doctors not to communicate with the patient. Now the relationship is reinforcing, because they know that there is a change in the life, and doctors are not so important as before, because Kaftrio is working very well. But from the Respiralia Foundation, we need to be in contact with the patients. I've seen a comment in the chat, very important. We still need to train patients with all the therapies. Anna said that she thinks that there's no need to abandon the physiotherapy, but if you do a bad physiotherapy, it's not a productive physiotherapy. So it is very important, if you apply autogenic drainage, which is a very difficult technique, to learn how to apply it. Then you can have even better results with the combination with Kaftrio that without autogenic drainage. So that's the point that we think that we have to be even closer to the patient right now.
Fantastic. So at least there are some new opportunities then for us as patient organizations to provide training and prepare patients for this kind of shift, I think. Luca.
Yeah, sorry, Luca,
Yeah.
yeah.
So Luca, you had some very interesting results in your poll, right? So you have been quite ambitious when collecting data through this web-based app, and now you're facing new regulations from EU. So about 50%, as far as I could see from your poll, did not know about this new regulation, and then there was some forth and back in the chats about whether or not it has been advertised a UPATI course about this new medical device regulation. So do you feel that we have enough resources in the area, that patient organizations should help to promote this knowledge about this new regulation, or what can we do?
Yeah, the new regulation is about medical device, also the in vitro medical device. It's very important. We have to know, because involve 24,000 medical device. Until 2024, all the notificate body need to recertificate. But the problem at today, only 32 notificate body work. The stakeholders, the industry say, probably half of these medical device after 2024 is not have the authorization for the CE. It's not possible to use. This is a big problem for us. Also, it's important, this regulation, because change the safety. Now the medical device have a similar route like drugs, like safety, like is more controlled, because for example, for sleep apnea today we have problems since last year for the Philips recall, but now with medical device regulation we are more safety. We have for example database, it's called Odemyr. It's very important, my opinion, the patient organization to study about this problem, because involve also the medicine like asthma, because if you use medical device with the drugs, involve this problem. We hope the notificate body have in 2 years recertificate all the device, because we risk a big stop until 2024.
Great. And Dominic had a comment in the chat box before and has raised her hand. So Dominic.
Yeah, I just wanted to reinforce what Luca was saying. We need to be aware that we as patients use a lot of medical devices. The simple thing like in our pressured meterized dose inhalers, the ones that still don't have a dose counter on that. Basically, if you would ask any patients, we would say this device is not allowed on the market because this endangers the patient's lives, and it's the combination medication medical device which is really important, but all the other medical devices as well. And I put down the UPATI course because it like the medicine UPATI course, it helps you to get an idea of what's happening with the medical device regulation and the information and knowledge you need to become involved as a patient. And I think we would really miss the boat if patient organizations and patients aren't getting prepared to do it. It's still in its early stages, but basically any or most medical devices, well, not a lot of medical devices will need to go through this process, and we need to be there to make sure that the patient perspective is guarded, because it creates so many problems afterwards that you almost can't correct later on. And what you also need to remember is that every digital system where doctor's advice is given to the patients based on the information you gather, whatever, that's a medical device. So we really need to be aware that this is really, really important.
I think that is a very good comment and great to have some attention paid to it. So thank you both, Luca and Dominique, for drawing our attention in this direction.